Hello, my name is Sarah Liu, and today I will be discussing what I've researched over the summer alongside my mentors, Dr. Dara Baldwin and Dr. Jeff Miazel. And so this summer, I studied whether or not maternal thiamine supplementation affects Cambodian infants' joint-attention interactions. And so I'm going to slowly kind of break down what this means throughout this presentation. There's a lot within that title, but for the basics and most basic context that you should know is that thiamine is also known as vitamin B1, is an essential micronutrient that is often found deficient in Southeast Asian countries due to their high rice-based diets, and this includes Cambodia. And so evidence suggests that thiamine deficiency significantly undercuts neurocognitive development and leads to lifelong ill effects. And if severe, thiamine deficiency can lead to a deadly disease known as beriberi. And so we investigated the extent to which low-dose maternal thiamine supplementation protects infants' ability to engage in joint attention interactions, which was assessed by a task that we created called the secondary engagement task. And so kind of to go into a little bit more what that means, maternal thiamine supplementation, the reason why we chose that rather than infant thiamine supplementation is because we're trying to find a solution to overcome this barrier of thiamine deficiency. And one of the ways that's very common nowadays is food fortification. And so our end goal to this project would be ideally to have a salt-based thiamine fortification program in Cambodia. And so the idea is that the mother consumes this said fortified food and eventually passes on this thiamine to her infant via breast milk. And so that's one of the main reasons why we chose maternal thiamine supplementation rather than the direct infant supplementation. And the second biggest component to this is joint attention. What exactly is joint attention? Joint attention is a concept that when two people train their attention on the same object, and in this case, it would be the mother and the infant. And so this is one of many examples that we see within each of our trials. They're video recorded. They were recorded around 2 to 3 years ago. But as you can see here, the mother is training her attention onto the toy, and the infant is also training their interest onto the toy as well. And so this is an essential, a prime example of joint attention. And so the reason why we wanted to study joint attention specifically was because joint attention provides crucial learning opportunities for infants. This includes language, includes cultural learning, includes motor activity, and it just keeps going. And so we really wanted to see whether or not thiamine affects this main crucial learning opportunity for infants. And so this leads to my research question, which is to what extent does the duration of joint attention episodes depend on maternal thiamine supplementation? And so the way that we conducted this experiment was a double-blind randomized control trial with 335 mothers, all of which who breastfed and received one of 4 levels of daily thiamine supplementation. And so those 4 levels either included 0 milligrams, which is our placebo group. We have a 1.2 milligram group, 2.4 milligram, and 10 milligrams per day. And that began 2 weeks postpartum and then ended when infants were 24 weeks old. And so within our experiment, we ran each of our subjects through the secondary engagement task, both during 12 weeks and 24 weeks. And so the secondary engagement task asked mothers to elicit and sustain infants' interest in a novel object. And so that's encouraging and eliciting, hopefully, joint attention. And the secondary engagement task consists of 5 30-second epics. And as those epics progress, the mothers were either prompted to add and then subsequently remove these engagement techniques. And this offered us the opportunity to observe infants' responsiveness to these different engagement cues. And so down below, you can kind of see in this chart, just the different onsets and offsets of these different engagement techniques. And so in our epics 1 and 5, we can see that no techniques are engaged. And then there's this kind of parabolic kind of form to our SET task. And so we can see that here in epic 3, it's the highest amount of engagement techniques are being administered. So both mother talking and gesturing at the toy and also looking at the toy. And so this moves on to our preliminary predictions and results. And so due to just time constraints and things like that, we were only really able to test whether or not SET is effective in measuring what we want it to measure. And so I have not yet answered my core research question of whether or not the duration of joint attention episodes depend on maternal thiamine supplementation, but rather just examining whether or not the secondary engagement task works for what we want it to do. And so one of two preliminary predictions that we made was that we would want to see developmental change. We want to see that the percent of time that the mother-infant dyads spend in joint attention generally increase relative to their 12-week trial. So we want to see just a general developmental increase. So we want to just see higher 24-week joint attention rather than their 12-week trial. And then the second one that we wanted to see was a validation of SET, whether or not it was acting in the way that we wanted to. So that includes just seeing that quadratic parabolic form to each of these trials and epics. So that would mean more specifically that in epics 2 through 4, where we wanted to see greater joint attention just because as you can see in this flow of events chart, there's more eliciting engagement techniques in here rather than epics 1 and 5, which have 0. And so on the right here, you can see exactly those two predictions play out. You can see here is 12 weeks, and this is measuring the mean percent of joint attention within each epic. And you can see here that epics 1 and 5 clearly are lower than epics 2 through 4, and same here with 24 weeks. And so this is exactly kind of what we wanted to see, which validated the secondary engagement task. And then we also see just a general increase of joint attention from 12 to 24 weeks, which is that developmental change that we were expecting to see. And so in sum, these results are actually really positive in setting the groundworks and framework for what we're going to want to measure off of later when we research our main research question of whether or not that duration is affected by thiamine supplementation. And so now we're confident that our secondary engagement task is measuring joint attention and eliciting it properly, just as we kind of theorized as we were creating this task. And so this leads me to just future directions of this project. Obviously, the first one would be to answer that main research question. Does the duration change based upon thiamine supplementation? And then the second one would be just to study other developmental markers that could or could not be affected by thiamine supplementation. And so we just want to continue really researching the effects on thiamine. And like I mentioned before, the broader goal of this project would be to implement a salt-based thiamine fortification program within Cambodia based upon our research, and hopefully other countries that are affected by thiamine deficiency as well. And so again, I would like to thank both my mentors, Dr. Dara Baldwin and Dr. Jeff Miazel, for helping me in this process and for funding me in this research and helping making this possible. So thank you so much. And I look forward to your questions.